Tracking new developments about Ebola in Northeast Ohio. The number of people being monitored for the virus is 159. That's up 17 from yesterday. 3 people remain in quarantine. Amber Vinson left the Akron area 8 days ago. Now is the time people would start showing symptoms if they'd contracted Ebola. And tonight, 5 on Your Side investigators are uncovering new information. Why haven't local hospitals released their crisis plans? And is Cuyahoga County really prepared? Investigator Sarah Buttison just spoke with county leaders. Sarah, what are they saying tonight?
Lee, they just confirmed 2 Cuyahoga County employees have been placed on paid leave for 2 weeks as a precaution because they came in contact with Amber Vinson. Cuyahoga County Council Safety Committee questioned Health Commissioner Terry Allen about the Ebola outbreak this afternoon. One area of concern, whether Northeast Ohio is prepared to handle this health crisis. Here's what Allen told me.
What plan do hospitals have if someone comes in with a fever?
Hospitals have been working very hard at several levels. There are issues tied back to EMS around transport, so there's work going on around the transport issue in terms of personal protection. Hospitals have been drilling and practicing should there be a person of concern that enters the system.
Allen said every hospital in Northeast Ohio can evaluate a patient who has a fever and may have been exposed to Ebola. But there are still details to figure out when it comes to what happens next. He said health officials and hospitals are working out where a patient would go first if they do test positive for Ebola. He expects to have more information soon about how healthcare providers would handle an Ebola patient. On Your Side, I'm investigator Sarah Buttison, News Channel 5.
Okay, Sarah, thanks. But once at a local hospital, how prepared are they?
Yeah, today, 5 on Your Side, Chief Investigator Ron Regan asked for specific details of plans and equipment. So, Ron, what have you learned?
Well, it's a secret. The hospitals we spoke with insist they are prepared, but when we press them for details, all said plans are not for the public to see.
On emergency Ebola plans, the Cleveland Clinic told us plans are continuously updated, adding it's an internal document, not shared. It would not tell us when the plan was first prepared or distributed. At university hospitals, their Ebola plan was developed in July 2014 and has undergone numerous revisions. It, too, is not available for public inspection. At Metro Health, details of the exact plan will not be given out, adding the plan is in a constant state of clarifying our protocol. On isolation wards, the Cleveland Clinic told us it has 2 negative pressure rooms, allowing only air in, not out of rooms. University hospitals and Metro Health both identified similar rooms for isolation, but would not say how many. Finally, on personal protective equipment, the Cleveland Clinic told us it's getting shipments continuously. University Hospital said it has several hundred, and Metro Health told us only it has many on hand.
Now, Akron General told us only that it has multiple treatment rooms available and, quote, plenty of personal protective equipment, but none would tell us just how many protective suits they have. Now, for a little perspective here, Doctors Without Borders last June said Ebola was out of control in parts of Africa, but it was a full month later we found out until the CDC issued its Level 2 health alert. That was July 28th, advising U.S. healthcare workers to be vigilant. I'm Chief Investigator Ron Regan.